Hello and welcome to your Learn It training for the Carry-Free treatment system. Before we dive in, please take a minute to locate your bright green toolbox containing your training packets and product samples to reference during this video. You should have received a few copies of the book Balance in your toolbox. Feel free to flip through it. It'll be a great resource to use as you work through implementation. Some offices like to photocopy sections of it for patients to take home so they have more information. You'll also notice throughout the presentation I've marked on some of the slides where you can find that section in the book. So to get us started, CAMBRA is an acronym that stands for Caries Management by Risk Assessment, and it's a protocol to manage and prevent dental caries through risk assessment. CAMBRA began in the early 2000s at the UCSF School of Dentistry with Dr. John Featherstone and his team, and it's supported by the California Dental Association Foundation. CAMBRA is the foundation of the Carry-Free system, which takes us into, who are we? Well, Carry-Free is a company founded here in Albany, Oregon by Dr. Kim Cooch. We manufacture a line of caries prevention products that includes tooth gels, oral rinses, mouth spray, gum, and lollies. We also have a caries screen test that measures biofilm activity levels. Our mission as a company is to educate the dental profession on CAMBRA and stop tooth decay. It's that simple. It's important when implementing a new system to ask yourselves what your goals are for the program. I encourage you to take a moment, stop the recording, and discuss why you're implementing the program and what you hope it does for you and your patients. If you're listening to this training, I can assume we share a common goal, which is the long-term health of our patients. CAMBRA is the foundation of the Carry-Free system, and I think we can agree that it's the right approach because it will provide the highest level of care to our patients. However, the challenge with implementing any new program is that it takes time and effort. It's a process, not a one-time event. Learning anything new requires you as a team to work together and utilize me as your coach to support you through the process. So let's dive into what that process looks like. Please locate your Reference It booklet and grab a pen or pencil. We will be walking through this today, and by the end of this video, you will have a solid starting protocol in place. Go ahead and turn to page 4 of your booklet. Here you will find the one form that is included in your program. You will use this form as your roadmap to take you and your patient from assessment to diagnosis and the recommendation of therapy. Once the patient's risk has been identified by their current state of disease, you can follow the treatment column found on your Caries Management Guide. Each column contains all of the information you will need to complete the process and make a therapy recommendation. You will notice the guide is set up to offer 3 levels of treatment: recommended therapy, provisional therapy, as well as the option to decline. Under decline treatment, you will also notice some percentages listed, which are meant to inform the patient of their likelihood of experiencing new decay within 12 months if no changes are made. The form is set up with the 3 levels of therapy to meet the patient at their level of motivation. We want to be sure they only select the treatment option they can realistically follow through with, and don't feel forced into purchasing anything if they aren't ready to begin treatment. On the back of the form, you will find additional information, Q&A, as well as conversation prompts for you. One of the helpful tools on the back, which is optional to fill out, is the risk factor checklist. It's there if you or the patient want to know why they've been placed in the risk category or if there are modifiable risk factors. This form is also intended to go home with the patient. Please turn now to page 2 of your booklet. At this time, you will need to decide a few things about the assessment process. First, who will you be screening? You have a few options here. You can either screen everyone or hand select. A few things to consider before you make your decision. The pros to screening everyone include, it's an easy protocol, and you don't have to think too much before talking to patients, and the more practice you get with the conversation, the better you will get. The cons to screening everyone is that it may be overwhelming at first with the sheer number of patients you see. If you choose to hand select patients, there are also some things to consider. The pros are starting small at first might help you get familiar with the system, and you know you'll be recommending it to the patients who need it the most. On the flip side, by hand selecting, you'll be missing out on early detection, and you'll be starting with the hardest patients to treat, the ones with the worst infection. So take a moment now to pause the video and discuss the 2 options. Now that you know who you will be assessing, take a moment to discuss who in the practice will be conducting the assessments. Great! So at this point we've determined who we are assessing, we also know how we offer treatment, and now let's talk a little bit about the products you have in office. When understanding this disease and explaining it to patients, the easiest way to look at it is in terms of a balance between risk and protective factors. A patient's level of risk is determined by how their particular combination of these items affects their oral environment. With every single patient you see, whatever is going on in their mouth is a result of this balance between their disease indicators, risk factors, and whatever protective factors they have. And it's our job to find out what protective factors and treatment products each patient needs to outweigh their level of risk and keep their balance in check. So what do we use to tip our patients' balance toward health? Well, we know that there are 5 recommended treatment components prescribed for caries management and that help change our patient's balance. The star figure you see is what we call the CTX guide. This guide provides a standard way to quickly assess all anti-caries products based on their contents. Those 5 components are pH neutralization, broad-spectrum antibacterial therapy, fluoride, xylitol, and nanohydroxyapatite, or forms of calcium and phosphate for remineralization support. Each individual product is given a score based on the number of those 5 components they contain. One of the benefits of the CTX guide is that it makes product comparison conversations with patients very easy. For example, we often get the question, how is Carie-Free different from a product I'm currently using? And all you need to do is plug whatever product the patient is asking about into the CTX guide and give it a score. So you can see the 3 main products listed here with the appropriate components highlighted for each one. It's also in the packaging of the product, which makes it convenient for you and the patient. So we're going to walk through each, starting with the CTX4 treatment rinse. This is the one that usually comes with the most questions. First, it's named the CTX4 rinse because it contains 4 out of the 5 components, which you can see highlighted on the screen, and again, it's also on the packaging of the product. Now, the main purpose of this particular rinse is the antibacterial component, and it will only be prescribed to high and extreme risk patients. One of the things to note about this rinse is that the antibacterial agent we are using is sodium hypochlorite, so it's a bleach solution, and in turn it has a pretty unusual taste. Now, I call it unusual because it's not the worst thing in the world, but it isn't the best either. You will get a varied response from your patients, and I just recommend that everyone tries it first before prescribing it to your patients, and be very upfront and honest with them about the taste. Next is the CTX4 Gel 5000. It also has 4 out of the 5 necessary components, which you can see highlighted on the screen. However, the difference is that this does not contain the antibacterial component. Instead, it contains nanohydroxyapatite, a form of calcium and phosphate, for remin support. The gel is included in each kit, which we will cover in just a moment, and is used as a toothpaste replacement. And last but not least, the CTX3 rinse. Named that because it contains 3 out of the 5 necessary components, which, again, you can see highlighted on the screen. And the biggest difference from this rinse and the CTX4 rinse is that this one does not contain the antibacterial component. So here you can see the 4 different CTX kits. As far as these kits are concerned, try not to get too hung up on the numbers. Just know the higher the number, the higher the level of therapy the kit contains. And all of the kits come with a 3-month supply of products. As far as instructions go, each kit contains an insert with the proper instructions for product use. If you compare, you will notice there are conflicting instructions on the products themselves versus the instructions on the insert, and that's because the products are labeled for individual sale. The instructions on the insert are the most effective and the ones we want patients to follow, not the instructions on the product. So now that we've covered the individual products, we need to decide what you want to charge for them and how you want to get the kits in the hands of your patients. We have provided pricing that is based on the averages we see practices charging. We also have a guide available without pricing if you decide you would like to set your own fees. Then it is important to decide if you'll be dispensing the product in the operatory or if you'd like the patient to pick it up at the front on their way out. If patients are going to get it at the front, just make sure whoever's checking them out feels comfortable enough finishing the process and possibly answering any last-minute questions the patient may have. Now let's discuss what to do with patients that take home product. Ideally, you'll want to see them again in office after they finish their kit. The reassessment appointment is pretty straightforward. You will simply be taking the patient back through the same process you did the first time. These appointments typically take about 15 minutes and can be done with an assistant or a hygienist. Because the patient takes home 3 months worth of product, we need to do something at that 3-month mark. If a 3-month exam is not realistic, then you need to set up contact for the 3-month mark. Schedule a phone call with a hygienist, assistant, or doctor to ask the patient, "Tell me how things are going. Have you noticed any positive changes since you started using the product? How are you doing on product? Do you have 1 week left? None? 3 months left?" And be prepared for anything. The most important thing is that they're honest with you. And lastly, you want to ask, what would work best for you to get another kit? They can either come in and you'll have it ready for them at the front, or you can have it shipped to their house using the drop ship option from the Carefree website. You'll also want to consider, if the patient comes in at 3 months, who will do the assessment? If the patient does not come in at 3 months, who will call the patient? And if the patient comes in at 6 months, how will you know to add the Carefree reassessment to their appointment? Okay, so what should we expect to see or hear from our patient at that first appointment? There are a lot of cues you can look for to gauge treatment progress. Have the patient first tell you what they've noticed, then look and see what's evident to you. And if you don't see progress, it's possible that the patient hasn't been using the product like they should. If this is a patient who is historically non-compliant, normalize the fact that sometimes people change their mind when they get home and don't end up using the products right away. Maybe they just got a late start. Maybe they've only been using it for a week. The goal is not to make them feel bad. Focus on getting them back on track. And long term, of course, we expect to see those big changes, and we will. So when you're thinking about your patients that have taken treatment home, these are some things we know can affect how long it will take them to get to their goal. How long the patient has had the caries infection plays a huge role, along with the number and severity of risk factors and whether or not they can be modified. Presence and severity of active decay is another factor influencing treatment time, and of course, the patient's compliance with treatment recommendations. So moving into the next few weeks, you'll want to decide on a launch date, a day that you will begin working with patients to put your protocol to work. If you would like to schedule a live Q&A session with a trainer, please be sure to get that on the schedule by calling 866-928-4445. If you have any questions about any of the content of this training or need more information, please don't hesitate to call or email, and have a great day.